At 2:17 a.m., a black military helicopter dropped out of the Denver sky without a radio call, without clearance, without warning, and landed directly on the roof of Hartwell Regional Medical Center like it owned the place. The soldier strapped to the stretcher inside had 3 entry wounds and was bleeding into his chest cavity faster than any surgeon on staff had ever managed before. Dr. Marcus Drell had 22 years of trauma experience, and he was already losing the patient. What he didn't know, what none of them knew, was that the terrified-looking new nurse standing in the hallway in scrubs 2 sizes too big had already survived exactly this moment, in a different country, under gunfire. Before we go any further, if you've never been here before, hit that subscribe button right now, because this channel is where the stories nobody tells out loud finally get told. If this one already has your heart racing, drop a like so more people find it. And tell me in the comments what city or country you're watching from. I want to see exactly how far this story travels. Now let's go back to the beginning of a night that changed everything. The badge still had the laminate peel on the back corner. Lauren Mercer hadn't bothered removing it. She'd clipped it to the chest pocket of her scrubs that morning, scrubs she'd borrowed from a donation bin at the nurses' station because her own hadn't arrived yet. And she'd told herself it didn't matter. The badge said her name. It said her department. That was enough. Hartwell Regional Medical Center sat on the eastern edge of Caldwell, Colorado, a mid-sized city that liked to describe itself as the intersection of the Mountain West and the modern world. The hospital was real enough. 12 floors, a level 2 trauma designation, a cardiac wing that had won regional awards 3 years running. It was not a small operation. And the night shift in the trauma unit, Lauren had learned in the first 40 minutes of her first shift, ran like a clock that had been wound too tight by too many people with too much to prove. She had taken a position in the corner near the supply alcove. Not hiding, she'd been assigned to stock the crash carts, and she was doing exactly that, working through a laminated checklist with a pen that kept skipping. She didn't try to introduce herself to anyone she hadn't been formally introduced to. She didn't ask questions that weren't necessary. She moved around the unit with the kind of quiet efficiency that came from years of working in spaces where noise attracted attention of the wrong kind. Nobody noticed her much, which was how she preferred it. "You the new hire?" A voice cut through the ambient noise of the unit. Monitors, distant call bells, the low conversation of the charge nurse on the phone. Lauren looked up. The speaker was a woman maybe 5 years younger than her, dark hair pulled into a utilitarian bun, wearing the look of someone who had sized her up and already reached a verdict. Her badge said Jessica Oren, RN, Trauma Unit. "Lauren Mercer," Lauren said. "Night shift, trauma support." Jessica looked at the checklist in Lauren's hand, then at the cart. "You have trauma experience?" "Some." "Where?" "Different places." Lauren kept her voice neutral and went back to the checklist. Jessica watched her for a beat longer than was comfortable, then left without another word. Lauren heard her say something to a colleague near the nurses' station. She didn't catch all of it, just the tail end. "Don't know why they keep hiring people like that without checking references." Lauren wrote it off. First shift at a new facility. People protected their territory. That was universal. What wasn't universal was Dr. Marcus Drell. She saw him for the first time at approximately 11:40 p.m., when a motor vehicle accident brought in 2 patients simultaneously and the unit shifted from low-grade tension to controlled chaos. Drell moved through the trauma bay like he was the gravitational center of the room, and everyone else orbited around him. He was mid-50s, broad across the shoulders, with silver-gray hair cut close, and a manner that made you feel like every decision he'd ever made had been correct, and he could prove it with documentation. The residents responded to him the way junior soldiers responded to a commanding officer, snapping to attention when he entered, completing his sentences, agreeing with his assessments before he'd finished stating them. Lauren watched him work from the doorway. His technique was solid, his communication was efficient. He called out for things before the nurses reached for them, which meant he'd done this enough times that the choreography was second nature. She felt a familiar twinge, not admiration exactly, more like recognition. She'd worked with people like Drell, people who were genuinely very good at what they did and who had never, not once, been required to question whether that was enough. She went back to the crash cart. Somewhere around midnight, the charge nurse, a tall, bone-tired man named Daryl, who Lauren suspected hadn't had a full night's sleep in years, came to find her. Mercer. Yeah. Dr. Drell's gonna need all hands available for the next hour. We've got 3 more incoming from a highway pileup. You comfortable with IV access and monitoring support? Yes? Good. Stay available, but don't get in anyone's way, and don't touch anything unless someone asks you to. The last part wasn't directed at her specifically. It was the standard instruction for anyone new to the unit, but it landed like a small weight anyway. Don't touch anything. She was a licensed, registered nurse with a trauma certification and a service record that would have made half the people in this building go quiet, and the instruction was don't touch anything. Understood, she said. The 3 MVA patients came in within 12 minutes of each other. Lauren worked the margins, holding pressure where she was asked, running labs, threading an IV in a patient with collapsed veins that 2 residents had already abandoned. She did it without commentary, got a single surprised look from the resident who'd been about to reach for an ultrasound guide, and kept moving. She wasn't trying to perform. She was trying to be useful without disturbing the ecosystem. It was working until Jessica Oren came to find her at 1:15 a.m. Dr. Drell needs to know your trauma training background for documentation. Lauren set down the supplies she was holding. It's in my file. He wants to hear it from you. She followed Jessica into the trauma bay where Drell was reviewing a chart at the central station. He didn't look up when she stopped in front of him. Mercer, he said. Yes. What's your trauma experience? I have an RN with certification in emergency trauma care. Prior to nursing, I worked in medical support roles in high acuity environments. Now he looked up. His expression was not hostile. It was worse than that. It was the look of a person running a brief diagnostic on a piece of equipment and finding it below spec. What does high acuity environments mean? It means I've worked in locations where stabilization had to happen without full facility support. Rural? Urgent care? No. Then what? She held his gaze. Forward operating environments. Drell set his chart down. The quiet around them got a degree quieter. Jessica Oren, standing 3 feet back, had stopped pretending to look at something else. Military, Drell said. Previously, yes. What branch? Army. He studied her face. What did you do in the Army? Medical support. Nursing? Among other things. Something in his expression shifted, not softening exactly, more like reclassification. He'd placed her in a category, and now he was deciding whether the category was a problem. You understand that what works in a field setting is not what works in a trauma unit, he said. We operate within a defined protocol structure here. We document everything. We don't improvise. I understand. Good. He picked up his chart again. Stay out of the active bay unless you're called in. I don't want someone with military habits second-guessing my residents. She didn't say anything because there was nothing useful to say. She turned and walked back to the supply alcove. Jessica Oren followed her. Don't take it personally, she said, and her voice had shifted just enough to suggest that she did, in fact, want Lauren to take it personally. He's like that with everyone new. I know, Lauren said. You don't, actually. People who come in thinking their outside experience qualifies them for everything. It causes problems here. We have a system. I'm not here to disrupt the system. Jessica made a small, skeptical sound and walked away. Lauren stood for a moment with her hand resting on the cool metal of a supply cart. She breathed slowly and deliberately. 4 counts in, 4 counts out. The way she'd learned to regulate herself in situations where showing a reaction was more dangerous than feeling one. She'd been in this building for less than 4 hours, and she'd already been categorized, warned, and sidelined by people who didn't know a single thing about her. She'd been through worse. She kept moving. The unit quieted between 1:30 and 2:00. Lauren sat in the break room with a cup of coffee that had been sitting too long on the burner. She was reviewing the facility's trauma protocol binder, not because she'd been asked to, but because she understood that the fastest way to navigate a new environment was to know its rules better than the people who'd written them. She was 3 sections in when she heard it. Not an alarm. Alarms she was used to. This was a voice on the PA system that carried a particular quality of controlled panic, the kind that people develop when they've been trained not to show fear, but the situation has exceeded the training, All trauma personnel to the rooftop landing pad. All trauma personnel to the rooftop. Lauren was on her feet before the announcement finished. She made it to the stairwell and up 2 floors in under a minute. When she pushed through the rooftop access door, the cold Colorado air hit her like a wall, and the helicopter was already on the pad. Not a civilian medical transport, not the hospital's own air ambulance. A military configuration, unmarked except for the tail number, rotors still cycling down. 2 figures in tactical gear were offloading a stretcher with the practiced speed of people who had done this under worse conditions than a hospital rooftop at 2 a.m. The man on the stretcher was military, not from his uniform, which was civilian, but from his build. The way he was positioned, the nature of what she could see from 10 feet away. He was large, late 30s, and the bandaging on his left side told her something had been applied in the field that wasn't holding the way it should. His color was wrong. His breathing was visible from here, which was not a good sign. Drell was already there, along with 2 residents and a respiratory tech. Lauren stayed back by the door, watching. 3 GSWs, one of the tactical figures said, walking alongside the stretcher as they moved. Entry left flank, left shoulder, right thigh. Thigh was managed in the field, bleeding controlled. Left flank is the problem. We couldn't get it to fully stabilize. What did you use? Drell asked. Combat gauze, direct pressure, 2 attempts. Kept weeping. BP? 92/60 when we loaded. Dropped to 88 at altitude. Drell's face stayed controlled, but Lauren saw the small tension in his jaw. He knew what that blood pressure trend meant. So did she. They moved the stretcher through the rooftop access and into the elevator bay, and Lauren followed at the back of the group, staying clear of everyone's path. She wasn't going to push herself into this. She was going to watch. But she was watching very carefully. In the trauma bay, Drell ran the team with the same efficient authority she'd seen earlier, calling assessments, ordering imaging, directing the residents. The 2 tactical figures from the helicopter had stationed themselves outside the bay doors. Not hospital staff, not security, just men standing with their arms loose at their sides and their eyes on the room. Lauren positioned herself near the supply wall, visible but not intrusive. The patient, she still didn't know his name, they never said it, was responsive, barely. He answered questions in single words. His eyes tracked movement. His blood pressure had stabilized slightly on fluids, 95/65. But his breathing was increasingly labored, and the left flank wound, even after the trauma team had removed the field dressing and repacked it, was doing something that Lauren recognized. She watched the monitor, watched the rise and fall of his chest, watched the way he kept shifting his left arm. Not voluntarily, she thought, not consciously. A reflexive response. Drell called for imaging. The portable X-ray was already moving toward the bay. Lauren took 1 step forward and stopped herself. Don't touch anything unless someone asks. She counted seconds. The X-ray was completed. Drell reviewed the images on the portable display, pointing out a fragment track to the senior resident. She could hear fragments of the conversation, but not all of it. She watched his face as he looked at the films and saw the moment where his expression shifted. Not to recognition, but to recalibration. Something wasn't fitting his model cleanly. The patient's monitor alarmed, heart rate spiking, pressure dropping again. 88 systolic, now 83. Push another liter, Drell ordered. Get me another set of films. I want to see the shoulder track. Dr. Drell, Lauren said it clearly, not loudly. He turned. His face was not welcoming. Mercer, I need you to step back. The left flank wound isn't the primary source. She kept her voice level. Look at his breathing pattern and the way he's positioning that arm. The pressure change isn't tracking with the flank repacking. It's behind the intercostal margin. The fragment went deeper than the imaging is showing. It may be partially occluded by hematoma formation. The room was quiet except for the monitors. Drell stared at her. One of the residents turned to look at the films again. The other one was watching Drell. You're a nurse, Drell said. You're new to this facility. Step back. I've seen this injury pattern. In theater, more than once. She held her ground. The field team said the flank wound kept weeping despite direct pressure and the right packing technique. That means the source isn't at the surface. You're managing the symptom. His voice dropped in temperature by several degrees. I said step back. The monitor alarmed again. 79 systolic. One of the tactical figures opened the bay door. He didn't speak. He just stood in the doorway and watched Drell with a quality of stillness that communicated something Lauren understood immediately. These men had not brought this patient here to watch a territorial disagreement kill him. Drell looked at the monitor, at the imaging, at Lauren, at the monitor again. The number dropped to 76. "What are you proposing?" he said, and the way he said it was not a concession. It was a man running out of road. Modified thoracic pressure assessment, right hand placement, intercostal space 5. You'll feel the resistance if there's occult hematoma accumulation. 15 seconds. If I'm wrong, I'll walk out of this bay and you'll never have to deal with me again. 7 seconds of silence. "Do it," Drell said. She was at the bedside before the words had finished leaving his mouth. She placed her hands with the certainty of someone who had done this in conditions that made a hospital trauma bay feel like a library. Her left hand flat against the patient's chest. Her right hand positioned at the 5th intercostal space, applying graduated pressure in a pattern that required understanding the relationship between external assessment and internal fluid dynamics. It wasn't in any civilian protocol she'd ever read. It was something she'd been taught in a shipping container in the middle of an austere environment by a trauma surgeon who'd spent 3 tours developing techniques for situations where imaging wasn't available. She felt it immediately. The subtle, unmistakable resistance. Not the normal compressibility of chest tissue, but something denser, collecting. There, she said, right intercostal margin posterior to the wound tract. You need to go in here." Drell was already moving. He didn't thank her. He didn't acknowledge her. He just moved. What happened in the next 11 minutes was technically precise and extraordinarily fast. Drell worked with the focus of someone who had set aside everything that wasn't the immediate mechanical problem in front of him, and he was very good at that, whatever else he was. Lauren stepped back to the wall. She handed instruments when asked. She monitored what she was near enough to monitor. When the patient's blood pressure climbed back to 102 systolic and his breathing evened out and the monitor stopped alarming every 40 seconds, the room's collective tension dropped in a wave that Lauren felt physically. Drell straightened up. He looked at the patient, then at his residents, then at Lauren. Nobody said anything. One of the tactical figures outside the bay door had his arms crossed now. He looked at Lauren the way she'd been looked at before, not with surprise, but with recognition, like someone who'd worked with people who knew things that didn't appear on any standard form. Drell stripped his gloves and dropped them into the waste receptacle. He turned toward the door without looking at Lauren again. "Mercer," he said, voice completely flat. "I want a full incident report on my desk by end of shift." He walked out. Jessica Oren, who had appeared sometime in the last few minutes and was standing near the monitoring station, watched him go. Then she looked at Lauren with an expression that Lauren couldn't entirely read, part hostility, part something more complicated, part the face of someone whose categories had just been scrambled. Lauren turned back to the patient. He was looking at her. His eyes were clearer now, which meant the pain was hitting him in a more organized way, which was its own kind of progress. "You good?" she asked quietly. He blinked once, slowly. It wasn't a nod exactly, but she understood it. She checked his lines, confirmed his monitoring was properly calibrated, and wrote the numbers in the chart with the steady handwriting she'd developed years ago because illegible notes got people killed. She was halfway back to the supply alcove to finish her checklist when she heard one of the tactical figures speaking quietly into a phone near the elevator bank. She wasn't trying to eavesdrop. She just had the kind of hearing that had been sharpened by years of listening for things, in environments where missing a sound could mean something catastrophic. She identified it, he said. "Yes, sir." Before the physician. A pause. "I don't know who she is, but she knew exactly what she was doing." Lauren kept walking. She retrieved her checklist from where she'd left it, smoothed the paper against the cart, and found her pen. The badge on her chest caught the fluorescent light. Lauren Mercer, RN, Hartwell Regional Trauma. She pressed the pen to paper and got back to work. In the administrator's office on the 4th floor, a phone was ringing. No one was there to answer it yet. By 4 a.m., someone would be. By 4 a.m., someone would be. And that someone was already on his way up. Richard Holt, Hartwell Regional's Chief of Clinical Operations, had been reached at home by the hospital's overnight administrator at 3:47 a.m. The call had been brief. An unscheduled military helicopter, A critical patient, a nurse who had intervened in an active trauma case outside her designated scope. By the time Holt's car pulled into the staff parking structure, he had already decided how he felt about it. He was not a man who enjoyed surprises. He had built his career at Hartwell on the premise that a hospital ran like a well-maintained machine, defined inputs, defined outputs, defined chains of authority. Deviations from that structure were not initiative. They were liability. He found Drell in the attending lounge at 4:20 a.m., sitting with a cold cup of coffee and the particular expression of a man who had been processing something he hadn't expected to need to process. "Tell me what happened," Holt said. Drell told him. He was accurate. He did not editorialize. But he also didn't volunteer the part where the patient's pressure had been dropping toward a number that wouldn't have allowed for a good outcome, and Lauren's intervention had changed the trajectory. He mentioned the intervention. He mentioned that it had been outside protocol. He stopped there. Holt listened. When Drell finished, Holt said, "She touched the patient without authorization. She assessed. I authorized the continued intervention." After she'd already initiated. Drell was quiet for a beat. The timing was close. "Where is she now?" "Finishing her shift. She's been on task all night. No further incidents." Holt stood. "Pull her file. I want a full protocol review on her actions tonight, and I want it documented before the morning administration comes in." He paused at the door. "And Marcus, the fact that the patient improved doesn't change the procedural issue." Drell said nothing, which was its own kind of answer. Lauren was in the medication preparation room when Daryl, the charge nurse, came to find her at 4:55 a.m. His face had the careful neutrality of someone delivering information he hadn't written. "Holt wants to meet with you before you sign out," he said. "Okay." "Lauren," he hesitated, "it might be worth having your documentation clean before you go in there. Everything you did tonight, in order, with reasoning. The more complete it is, the better." She looked at him steadily. "Thank you, Daryl." He nodded once, briefly, and left. She finished what she was doing first. That was habit. You completed the immediate task before you managed the administrative problem, because the immediate task affected a patient, and the administrative problem only affected her. She checked the medication tray twice, confirmed the labeling, and handed it off at the nurse's station. Then she found an empty charting terminal and spent 20 minutes writing the most precise, clinically specific incident account she had ever produced. She included timestamps. She included the patient's vitals at each decision point. She included the physiological reasoning behind her assessment and the specific technique she'd used, with notation that it was derived from advanced trauma training received during her military service. She did not hedge. She did not apologize. She did not say she hoped it had been the right call. She printed 2 copies, signed both, and kept one. Holt's office was on the 4th floor, and at 5:30 in the morning it smelled like coffee and recycled air and the particular mustiness of a room that was more often occupied than ventilated. Holt himself was behind his desk. Jessica Oren was seated to the left. That was the first thing Lauren noted, that Jessica was in the room, which meant this had already been discussed in some form before she arrived. There was no chair set out for Lauren. She stood. "Ms. Mercer," Holt said. He was a compact man in his mid-60s with the kind of even, measured delivery that came from years of conversations exactly like this one. "I've reviewed the incident report from Dr. Drell, and I've heard a preliminary account from Nurse Oren. I'd like to hear your version." "I've prepared a written account," Lauren said, and set the document on his desk. "Everything in sequence, with clinical notation." He glanced at it but didn't pick it up. "In your own words." So she gave it to him. Same facts, same sequence, same clinical reasoning. She watched his face while she spoke, and she read nothing particularly useful in it. He was good at this. When she finished, he said, "You understand that what you did constitutes unauthorized patient intervention. I understand that the protocol framework places boundaries on scope of practice," she said. "I also understand that the patient's pressure was 76 systolic and declining when I spoke, that Dr. Drell was working from an incomplete assessment of the injury's depth, and that the time required to go through a formal consult structure would have materially worsened the outcome. That's a judgment call that is not within your authority to make." "I made it anyway." Something small shifted in Holt's expression. Not anger. He'd probably managed past anger a long time ago. more like the recalibration of someone who had expected a different kind of response. Jessica Oren said, "We have no verified record of the military training she's referencing. Her file contains an RN credential and a trauma certification, and that's it." "The training was conducted within a military context," Lauren said. "The documentation is held by a different institutional system. I can provide contact information for verification." "That's not how we credential here," Jessica said. "I know." "Then you know that as far as this hospital is concerned, you performed a technique that isn't in any protocol we operate under, on a patient you weren't assigned to, in a scenario where the attending physician had not formally requested your involvement." Lauren looked at her. "Dr. Drell authorized the intervention after you'd already started." "The patient was dying," Lauren said, and her voice stayed completely level because she'd learned a long time ago that volume and urgency were not the same thing. "I had information relevant to keeping him alive. I used it, and he's alive." The room was quiet. Holt looked at the document she'd set on his desk. He picked it up this time and read through it slowly, not performing consideration, actually reading. His eyes moved line by line. She watched him reach the section where she'd described the specific assessment technique and seen the brief pause that meant he'd encountered something unfamiliar. "You're on administrative review pending investigation," he said finally. "That means restricted duty, no active patient care, no trauma bay access, administrative tasks only until this is resolved." "How long?" "Until we've completed a review, a few days, potentially longer." He set the document down. "This isn't punitive. It's procedural." She knew better than to say what she was thinking, which was that those two things were not mutually exclusive. "Understood," she said. "You're dismissed." She turned and walked to the door. She had her hand on the frame when Holt said, "Ms. Mercer." She stopped but didn't turn around fully. "Whatever your background is, and I'm not dismissing it, this hospital has a structure that exists for reasons. We can't function if individual staff members decide when to follow it and when to override it. You may have been right last night. That doesn't settle the question of how we operate here." She nodded once, without turning all the way, and walked out. In the hallway, she stood for a moment with her back against the wall and her eyes on the ceiling. The fluorescents hummed. Someone's cart wheeled past at the far end of the corridor. She breathed slowly and deliberately and let the anger she hadn't shown in the office move through her like a current that had nowhere to discharge. She'd been here 12 hours. The shift was supposed to end at 7. She went to finish it. The next 36 hours were quiet in the way that certain kinds of storms are quiet before they reorganize. Lauren performed her restricted duties, supply inventory, documentation audit, scheduling support, with the same attention she'd given everything else, which was more than the tasks required but less than she was capable of, which made it its own kind of discipline. The nursing staff mostly gave her space. A few were coolly professional. One, a night shift tech named Becca, who was 24 and had the blunt social calibration of someone who hadn't yet learned to be strategic about friendliness, brought her coffee without being asked on the second day and said, "For what it's worth, I heard what you did with the helicopter guy." "It was a team call," Lauren said. "That's not what I heard." Lauren wrapped her hands around the cup. "What did you hear?" "That you told Drell where the bleed was coming from, and he went in there and you were right." Becca leaned against the counter. "Also that you got put on desk duty for it, which is—" She made a face that said more than any word she chose would have. "It's procedural," Lauren said, using Holt's word. Becca looked at her with the uncomplicated directness of someone who hadn't yet learned to mistake bureaucratic language for truth. "Sure," she said, and went back to work. On the second day, Daryl stopped by the records room where Lauren was working and closed the door behind him. "There are people asking questions," he said. "What kind of people?" "Not hospital people." "I don't know exactly. Administration got a call this morning that came through a different channel than the usual ones." Holt took it behind a closed door and came out looking like someone had rearranged his furniture. He paused. "I thought you should know." "Thank you, Daryl." "Lauren." He said it the way people said a name when the name was a substitute for something more complicated. "Whatever your story is, you don't have to tell me. But if there's something incoming that I should be managing on the unit's behalf, it would help to know." She thought about that. She looked at the stacks of documentation around her. All this paper, all these systems, all these structures built to give shape to the chaos of keeping people alive. And she felt, not for the first time, the gap between what she was and what any of these forms could possibly say about her. "There might be some people coming," she said carefully. "I don't know when. I don't know what they'll want to do." She met his eyes. "But when they arrive, I need you to trust that they're not here to hurt anyone in this hospital." Daryl studied her face for a long, assessing moment. He'd been doing this job for 17 years. He'd seen things. "Okay," he said, and left. She was wrong about the timing. She'd expected days. She got hours. At 11:28, on her second day of restricted duty, Lauren was in the records room when she heard the sound of the elevator opening on the administrative floor. Not unusual in itself, but followed by the particular cadence of footsteps that she recognized in the way you recognize certain sounds after enough exposure to them. Multiple people, moving with purpose but not urgency, comfortable with institutional spaces. Not looking around for signs. She stood up. Holt's assistant appeared in the doorway. Young woman, perpetually stressed expression, holding a tablet. "Ms. Mercer, Mr. Holt needs you in the conference room." "Now?" "Yes." Lauren followed her down the hallway to the main conference room on the 4th floor. Through the glass wall panel, she could see Holt already seated, and across from him, 2 men in civilian clothes that were cut just differently enough from civilian clothes to communicate military background to anyone who knew what to look for. A woman in a dark jacket sat to the right, with a folder in front of her. No one from hospital administration except Holt. Lauren went in. Holt said, "Sit down, please," and his voice was different from the version she'd heard 2 mornings ago. Not warmer exactly, but carrying less of the administrative certainty that had been his primary mode. He'd been recalibrated. She recognized the signs. The man to her left, 50s, crew cut going gray at the edges, a stillness to him that was characteristic of a very specific kind of operational experience, said, "Lauren, my name is Colonel David Archer. I'm with the Army Medical Command. This is Major Serrano and Dr. Elise Vaught, who serves as a liaison to the DoD Health Services Office." He paused. "You saved one of my soldiers 2 nights ago." She said, "How is he?" "Recovering." A brief pause in which something moved in Archer's expression that didn't quite become visible. "He'll need time, but he'll recover. The thoracic assessment you performed identified a hematoma accumulation that the imaging had missed. The attending physician confirmed that without that intervention, the patient would have gone into hemorrhagic shock within— "I don't need the timeline," she said. Archer looked at her steadily. "No, I suppose you don't." He leaned forward slightly. "We need to talk about who you are." She said, "I'm a registered nurse employed by this hospital." She said it without irony and without particular emphasis. It was the factual statement of what was true right now, in this room, under the fluorescent lights of a hospital conference room in Caldwell, Colorado. "You're also former Staff Sergeant Lauren Mercer of the 75th Ranger Regiment's attached medical element," said Major Serrano, reading from nothing, speaking from memory. 4 deployments, advanced trauma training under the TCCC Plus program, 13 documented field stabilizations under direct contact conditions, and a medical discharge after the Kandahar incident. The pause she left was deliberate, which we're all aware is a description that doesn't come close to covering what actually happened. The room was quiet. Holt was looking at Lauren with the expression of a man who had thought he understood the dimensions of the object he was measuring and had just discovered he was missing an axis. Lauren looked at the table for a moment, not in embarrassment, something more complicated. The look of someone who has carried a version of themselves for long enough that having it named out loud by someone else creates a strange, brief dislocation. "You have full access to that record," she said. "We do," Archer said, "which is why we're here." "What do you need from me?" Initially, a conversation. He opened a folder, actual paper, she noted, which meant it was sensitive enough that digital trails were being managed. "This hospital's administration has filed an incident report that is currently moving toward a formal action against your employment here. We want to address that." "With what authority?" Dr. Vaught spoke for the first time. She was early 50s, compact, and she spoke with the precision of someone who had spent a career making sure language meant exactly what she intended it to mean. The patient you treated is an active duty special operations officer whose medical outcome has national security implications that go beyond what this hospital's administration is aware of. That gives the Department of Defense a material interest in how this incident is characterized and adjudicated. You're going to intervene in the hospital's disciplinary process. We're going to provide context, Vaught said. What the hospital does with that context is their decision. Lauren looked at Holt. He was sitting with his hands flat on the table and his expression doing the complex arithmetic of a man calculating how much of what he thought he controlled had just turned out to be variable. "Can I ask you something?" she said, and she said it to Holt, not to the military people. He nodded. "When you put me on restricted duty, was it because you genuinely believed I'd done something wrong, or was it because the procedure required a response and you needed to produce one?" Holt was quiet for a moment that was longer than it needed to be if the answer was simple. "Both," he said finally. "The protocol exists for real reasons. You violated it. Those are both true at the same time." She appreciated that. It wasn't the answer she'd wanted, but it was an honest one, and honest was something she could work with. Archer said, "Lauren, what we'd like to do—" The door opened. Everyone at the table turned. It was Holt's assistant, and her expression had abandoned its usual stressed professional composure entirely. "I'm sorry," she said, directing it at Holt. "There's— Dr. Drell is outside. He says it's urgent. Tell him— He says it's the patient, the helicopter patient." She looked at Lauren in a way that made Lauren's chair scrape back from the table before she'd consciously decided to stand. "He says something's wrong." Lauren was already moving to the door. Archer said from behind her, "Mercer." "What floor?" she said to the assistant. "Third, Trauma Bay 2. She went. The stairwell was faster than the elevator. She took it at a pace that would have looked reckless to anyone watching and was actually very controlled. Each footfall deliberate, hand on the rail at turns, using the descent rather than fighting it. She hit the third-floor door at speed and came out into the corridor, already reading the unit, who was moving, how fast, in which direction. Drell was outside Trauma Bay 2. He saw her coming and his expression did something complicated. Relief and irritation, and something that might, in different circumstances, have been gratitude, all arriving at the same moment and clearly unwelcome in combination. His pressure dropped again, he said, not wasting time on context. 40 minutes ago, stable. 20 minutes ago, 87 systolic. Now 82 and trending. Same side? Left. The wound looks stable externally. It's not the wound, she said, and pushed into the bay. The soldier, she still didn't know his name, they still hadn't told her, but she knew his body now the way she'd learned to know the bodies of men she'd worked on in the field. The specific grammar of someone's physiology under stress. Was semi-conscious, which was worse than the last time she'd seen him. His color was off. His breathing was doing the thing it had done before. That shallow, compensatory pattern that was the body's way of protecting something. "You've been watching his respiratory excursion?" she asked. "Yes," said the resident at the monitor. 20s, female, sharp eyes, barely holding the anxiety that was coming off the room. "It's been asymmetric for about 20 minutes, Lauren said, since the pressure started dropping. She moved to the left side of the bed. Her hands were already positioning. "Get me a thoracic ultrasound and have your chest tray ready. This might be a delayed hemothorax." "Mercer," Drell said from directly behind her. His voice was low, and it was not the voice from their first meeting. "You're on restricted duty. If I authorize you in this bay, I'm putting both of us in a position—" "Then authorize me," she said without turning around. The silence behind her lasted exactly 4 seconds. She counted them. The monitor alarmed at second 3. "Do what you need to do," Drell said. She did. The ultrasound confirmed it. Fluid accumulating in the left pleural space, a delayed bleed from the fragment tract that the initial stabilization had slowed but not resolved. It was not a fast-moving emergency, which was its own relief, but it was a real one, and it would have continued moving in the wrong direction without intervention. She talked Drell's resident through the needle thoracocentesis, not because Drell couldn't do it, but because he was watching her hands, and she could see it in the stillness of his attention that he was doing what experienced clinicians did when they encountered a technique that was new to them. He was learning. She gave instruction clearly and without condescension, and she answered the resident's two questions without making her feel inadequate for asking. The fluid drained, the pressure stabilized. The soldier's breathing shifted back toward normal, slow, and visible, like watching a tide come back in. Lauren stepped back. She stripped her gloves. Her hands were steady. Drell said quietly, "Where did you learn needle thoracocentesis without a formal surgical set?" "Improvised equipment. Forward position. Our surgeon was down." She looked at him directly. "You work with what you have." He nodded. Not the small dismissive nod of a man categorizing an underling. The different kind. She was washing her hands at the sink when the door opened and Archer came in, followed by Vought. They'd come down from the conference room. They'd seen enough. Archer looked at the patient, at the monitors, at Lauren. "Still want to have that conversation?" she asked. "More than ever," he said. But before he could continue, Holt appeared in the doorway. He'd followed from the conference room too, or he'd come separately, or some combination. It didn't matter. He stood there looking at the bay, and at Lauren, and at the military people, and at Drell, who was standing to one side writing notes and radiating the body language of a man who had arrived at a conclusion but hadn't yet decided how to announce it. Holt said, "Marcus." Drell looked up. "What's your assessment of this nurse's clinical performance tonight?" The room went still. Even the monitors seemed to quiet. Drell set his pen down. He looked at Lauren, and whatever he was working through moved across his face in the way that emotion moved across the face of a man who did not express emotion casually, briefly visible, immediately controlled, but real. "Exceptional," he said. "Both instances." Holt absorbed that. His jaw moved slightly, not speaking, just processing. He looked at Lauren. "I'll be reviewing the restriction status," he said. "Thank you," she said, and meant it without warmth or triumph, because neither was appropriate. It was just a fact being acknowledged. She turned back to the sink and finished washing her hands. Behind her, she heard Archer say something to Vought in a low voice. She didn't catch all of it, but the last word she caught was a name. Not hers. The name of the patient. She stopped moving. The water ran over her hands. She stood there with her back to the room, and the name she'd just heard assembled itself in her memory next to a specific place and a specific night and a specific chain of events that she had spent 2 years trying to set down. She turned off the water. She dried her hands with deliberate care. She turned around. Archer was watching her. "You know who he is?" he said. It wasn't a question. "I think so," she said. "Then you understand why this situation is more complicated than a hospital incident report." She looked at the man in the bed. The rise and fall of his chest, normal now, steady, doing what it was supposed to do because she'd been here, both times. "What happened to him?" she asked. "Why was he—" "That's what we're trying to figure out," Archer said. "And it's why we need your help, not just medically." He paused. "The people who put those bullets in him, we think they knew his route. They knew his timeline. Someone gave them information that should not have been accessible outside a closed operational system." Lauren looked at Archer. "And you think the information trail leads somewhere near this hospital," she said. Vought opened the folder she'd carried down from the conference room. She set it on the edge of the bed table, not showing Lauren everything, just enough. A partial communication record, a location timestamp, a facility code that Lauren recognized because she'd seen it on hospital administrative documents in the last 2 days. The room felt smaller. "Ms. Mercer," Vought said, "we need to know if, in the last 48 hours, you've seen or heard anything in this facility that seemed out of place." Lauren's mind moved back through the last 2 days with the systematic precision of someone who had been trained to retain operational detail. The conversations, the faces, the administrative patterns, the phone calls she'd overheard Holt taking on her second morning, the specific words she hadn't been able to catch, the door that had been closed. "Yes," she said. Holt, standing in the doorway, went very still. And Lauren understood, with the particular clarity that came from having survived enough situations to recognize when a situation had changed shape around her, that the night shift had not ended. It had only just found its actual starting point. Holt moved first, not toward them, not away, but in the small reflexive shift of a man whose body had received information his mind was still refusing to organize. I took one step back from the doorway and then stopped, as though he'd hit an invisible wall. and Lauren watched the calculation move through him. How much he'd heard, how much they'd seen him hear, whether the door being partially closed when she'd walked past on her second morning had been enough. It hadn't been. She'd heard his voice, she'd heard the door. She hadn't heard the words. She'd told Vought yes without knowing exactly what she was confirming, because the pattern was what she'd recognized, not the content. The pattern of a man managing a conversation he didn't want witnessed. The pattern of someone controlling the shape of information. She'd seen it before, in different buildings, in different countries. The behavior was the same. Archer had seen Holt's movement too. He didn't look at him directly. That was another thing Lauren recognized, the way you could monitor someone without making it visible. But she could tell by the slight recalibration in his posture that Holt had just moved himself into a different category in Archer's assessment. "Mr. Holt," Vought said, and her voice was professionally neutral in the way that sharp objects were sometimes described as clean. "We'll need the room." "This is my hospital," Holt said. "And this is a federal matter with active national security implications," Vought said. "I can get you the documentation within the hour if that's what you'd like. Or you can give us the room, and we can resolve this without that step." The silence lasted long enough to be an answer. Holt left. The door closed behind him, and Lauren stood in the trauma bay with Archer and Vought and the soldier in the bed and the specific quality of quiet that descended when a room stopped pretending to be something it wasn't. "What did you see?" Archer asked. She told him, in order, without embellishment. The closed door on her second morning. Holt's voice, too low to catch words but carrying the particular cadence of a conversation being managed rather than conducted. The way he'd come out of that call with his expression reorganized, slightly too smooth. The fact that the call had come through a different channel, Daryl had said that, through a different channel than the usual ones, which in a hospital meant something had bypassed the main switchboard, which had its own implications about routing. Vought wrote nothing down. Lauren suspected she didn't need to. "The facility code on that document," Lauren said. "That's Hartwell's institutional code." "Yes." "Which means whoever transmitted that information had access to hospital administrative systems." "That's one interpretation." "What's the other one?" Vought and Archer exchanged a look that communicated something in the compressed language of people who worked together closely enough to have developed a shared shorthand. "The other interpretation," Vought said carefully, "is that someone used a spoofed institutional code to obscure the origin point. Both are possible. We don't know yet which is accurate." "But you came here," Lauren said. "You came to this hospital, so you think it's the first one." "We think it warrants investigation," Archer said, "which is not the same thing as certainty." She looked at the soldier. His monitoring was steady. His color had improved enough to be visible. She thought about how close it had been. Both times, in two separate windows, the second one more insidious because it had crept up slowly under the assumption that the first intervention had resolved the problem. "Who else had access to his route information?" she asked. "That's a very short list," Archer said, "and everyone on it has been cleared or is currently under review. Except you came here." "Except we came here," he confirmed. Drell was still in the room. He'd stepped back toward the wall when Holt left and had been standing there with the stillness of a man deciding something. Lauren had almost forgotten him, which was its own kind of statement about how much the situation had shifted from the one that had existed 48 hours ago. "I need to step out," Drell said. Not a request. A statement, delivered to Archer, not to Lauren. He looked at the soldier one more time, the look of a physician confirming a patient's status before transferring responsibility. Then he looked at Lauren. "You have him?" "Yes," she said. He nodded and left. For the next 20 minutes, Lauren gave Archer and Vought everything she had, every detail she'd filed away in the last 2 days, every interaction that had registered as worth remembering. She was thorough and she was honest, including about the things she was uncertain of, because in her experience, the spaces between certainty were where the actual information lived. Vought asked precise questions. Archer mostly listened. When Lauren finished, there was a pause in which the only sound was the monitors and the distant background noise of a hospital in its mid-morning operations. "We're going to need you to do something," Archer said, "and you can say no." "What?" "We need someone on the inside of this unit's administrative structure for the next 12 to 18 hours. Someone who can move through the facility without creating attention, who understands what they're looking for and won't misread it." He paused. "We have federal investigators, but they're visible. They change behavior. You're already here. You're already part of the pattern. You want me to observe Holt. We want you to continue your duties normally and tell us what you see, while remaining on restricted status. We're resolving that, Vought said. Your restriction is going to be lifted within the hour. There's a formal communication being prepared that establishes the military's position on your actions in this bay. Holt will receive it before noon. Lauren looked at the wall for a moment. And if I say no? Then we proceed without you, Archer said. We'll get what we need. It'll just take longer, and the person who gave up that route information will have more time to establish distance from it. She thought about the soldier in the bed. She thought about how the second bleed had developed, slowly, silently, looking like stability from the outside while something was wrong underneath. She thought about how many times she'd seen that pattern and what it meant when you missed it. I'll do it, she said. She was back on full duty by 11:47 a.m. The communication from the DoD Health Services office arrived at Holt's desk as promised. She didn't see it happen, but she heard about it through Daryl, who came to find her in the supply room with an expression that was doing its best not to communicate anything and mostly failing. Holt lifted the restriction, he said. Full active duty reinstatement effective immediately. He didn't explain why. Okay, she said. Lauren. I know, Daryl. He looked at her for a moment with the expression of a man deciding not to ask the question he was asking. Okay, he said, and that was the end of that. The afternoon was an exercise in the particular discipline of appearing ordinary. Lauren moved through her shift with the same even attention she'd given every other task since arriving at Hartwell. Thorough, quiet, slightly more observant than any given moment required. She restocked the trauma bay. She assisted with 2 non-critical cases in the afternoon. She reviewed documentation with the kind of focus that made her look like a nurse who cared a lot about record accuracy and not like someone who was tracking the movement patterns of the hospital's chief of clinical operations. Holt moved differently now. She noticed it by comparing in her first 2 days had been deliberate and controlled, the movement of a man who'd organized his environment to his specifications. This version was slightly faster, slightly less linear, making choices that didn't follow the most efficient path from A to B. How was managing something. At 2:15 p.m., she passed the administrative corridor on her way back from the pharmacy and heard 2 voices in Holt's office. She caught 4 words through the door, before they pull records, and kept walking. At 3:40, she was near the nurse's station when she saw Holt walk through the unit carrying a tablet she hadn't seen him carry before. Not his usual device, thinner, darker case. He moved to the medication room, which was unusual given that he had no clinical role that required presence there, and she watched through the small window in the door as he made a call on the tablet, standing with his back to the glass. She documented the time. She documented the location. She sent a text message to a number Vought had given her from a phone she'd borrowed from Becca on the pretext of her own battery being dead, which was true in the way that things could be true and also strategic. By 5 p.m., she had developed a reasonable picture of what Holt was doing, which was conducting a quiet and increasingly frantic effort to verify how much investigators knew and to create distance between himself and whatever chain of communication had led them here. She couldn't confirm the specifics, but the behavior pattern was legible. She'd seen it before in operational contexts, the way someone who knew they were being closed in started optimizing for exit rather than for defense. The question was whether he'd had help inside the hospital, and whether that help had done more than transmit information. She was in the trauma bay checking on the soldier when that question got a partial answer. Jessica Oren came on for evening shift at 5:30. Lauren had been expecting this. The shift overlap was standard, and Jessica had been working evenings since before Lauren arrived. What she hadn't expected was the specific thing she observed at 5:52 p.m. She was coming out of the medication room. The real reason for being there was a patient inventory that needed reconciliation. When she saw Jessica at the nurse's station, and what Jessica was doing was not entering charting or reviewing handoff notes. She was looking at the admissions record for a specific patient. She was writing something in a small notebook she'd angled away from the station cameras. She closed the notebook before anyone could have seen what she'd written, but she hadn't seen Lauren. Lauren went back into the medication room and stood against the wall and thought for exactly 90 seconds. Then she sent another text. Vought's response came in 45 seconds. Don't approach. Continue normal activity. Lauren put the phone in her pocket and went back to work. By 7 p.m., she understood she was not going to be able to sustain this much longer. Not because she was losing focus. Her focus was fine. It was doing what it was supposed to do. But because the situation was compressing in a direction that was going to require action from someone other than her, and the timing of that action mattered more than she could control from where she was standing. At 7:22 p.m., the soldier in Trauma Bay 2 began to decompensate for the third time. It was different from the previous two episodes. His pressure dropped faster, and the pattern wasn't consistent with another occult bleed. She ruled that out in the first 90 seconds because his respiratory excursion was symmetric, and his abdominal findings were unremarkable on palpation. What she found instead, when she went to his IV line to check the infusion, was something that stopped her hands for 1 full second before her training took over. The drip chamber was wrong, not the rate. The rate was set correctly. But the color of the fluid in the chamber was off by a degree that most people would not have caught, because it was subtle, and it required knowing what the correct baseline looked like, with enough precision to notice a deviation of approximately 15%. Lauren knew. She'd calibrated and recalibrated IV solutions in conditions where even small errors had immediate consequences, and there was nobody to catch your mistakes. She clamped the line. She did it without announcement, without calling for help. Because what she needed first was to preserve the evidence, and second was to understand what she was looking at. She checked the bag at the infusion point. Standard saline labeling. She held it up against the overhead light at the angle she needed, and the aberration was visible, not to someone glancing, but visible to her. Something had been introduced into the bag at the infusion port. She clamped the secondary line, opened a new bag from sealed stock, ran a flush with confirmed sterile saline, watched his pressure on the monitor. 81/79. She initiated emergency protocol and called for Drell over the unit comm. She also, in the same motion, sent a one-word text to Vought. Now. Drell arrived in 90 seconds. He took one look at the clamped original line and at Lauren's face and said, "What am I looking at?" "Compromised infusion," she said. "I don't know what was introduced. I preserved the bag and the line. Do not discard anything from this bay." He went still. Not the stillness of confusion, but the stillness of a man who had just recalibrated a situation in real time and didn't like the shape of where it had landed. "Someone accessed this room," he said. "Yes." "When?" "Between 4:30 and 6. I was away from this bay for approximately 25 minutes in that window." His jaw tightened. He looked at the preserved bag. "This is a criminal matter." "Yes." He reached for the bay phone and she put her hand on his arm. Not hard, not restraining, just contact that made him pause and look at her. "Federal investigators are already in the building," she said. "Call the unit line for security, document the time, and let Daryl know. That's the correct protocol path. The other elements are already in motion." He stared at her. "Trust me for 2 more minutes," she said. He picked up the phone and called security. The next 20 minutes moved in the compressed, over-detailed way that critical events moved, every second more legible than usual, every movement carrying more information than it would under normal conditions. Security arrived. Drell managed them. Lauren stayed at the patient's bedside, managing his infusion, watching his pressure climb back towards safety on the clean fluids, talking to him in a low voice, even though he was only partially conscious because she'd learned that people in that state still processed sound, and stillness was not what she wanted him to have right now. His name, she now knew, was Captain Reed Callahan. Archer had told her that morning after Holt left the room. She didn't use it out loud. Patient privacy was patient privacy regardless of circumstances. But she held it in her mind like a reference point. "You're going to be okay, Captain." Not out loud. Just the thought, held steadily, doing what thoughts did in the background of action. Vought arrived at the unit at 7:48 p.m. She came with 2 people Lauren hadn't seen before. Not in military uniform, not overtly federal, but carrying themselves in a way that communicated authority without performing it. She spoke briefly to Drell. She looked at the preserved bag and the clamped line with an expression that did not change but carried significant weight. She looked at Lauren. "You identified the contamination. The color was off." "How off?" "Maybe 15%. In the drip chamber under direct overhead light, at about a 30-degree angle." She paused. "Most people wouldn't have caught it." "No," Vought said. "They wouldn't have." At 8:03 p.m., Lauren was in the corridor outside the bay when she heard the sound from the administrative floor. Voices, more than usual, carrying the quality of a situation that had stopped being contained. She looked up the stairwell and saw light moving through the gap between doors. She stayed where she was. Daryl came to find her 3 minutes later. His face had moved through several expressions and settled on one that she could only describe as the look of a man who had trusted someone and found out what that trust had actually been worth. "They're detaining Holt," he said. She said nothing. And Jessica. She'd expected the first. The second landed differently. Not with surprise. She'd sent the text, she'd given the information, she'd known what she'd seen at the nurse's station, but with the particular weight of a fact becoming real. Jessica Oren had been in this unit for years. She knew these patients by room number, by family name, by the specific shape of their fear. Whatever had led her to that admissions record, and that notebook was its own story, and Lauren didn't know it, and she wasn't sure she wanted to, because the knowing would make it harder to hold the anger at the right temperature. "Is the unit going to be okay tonight?" Lauren asked. Daryl blinked. He seemed surprised she'd asked that rather than something else. Yes, we're covered. I've got staff." "Okay." She went back into the bay and checked the patient's lines. His pressure was 98 systolic and holding. His breathing was regular. She made a note in the chart with the timestamp and the clinical notation for the contamination discovery and the action taken. Every step in sequence, every number correct. She was sitting in the chair by the monitoring station when Archer came in at 8:30 p.m. He pulled the second chair out and sat across from her with the manner of someone who had enough respect for the situation not to try to make it feel like something other than what it was. "Holt has been taken in for questioning," he said. "We believe he was the point of transmission, not voluntarily, or at least not directly. Someone had access to his credentials, used them to pull the routing information. He may have known some of it. We're still working out the degree." And Jessica. She was passing Callahan's monitoring data. Not the route, the medical status. Someone wanted to know if he'd survive. Lauren looked at the floor. "Who?" "We're working that." "Someone wanted him dead enough to try it twice," she said. "Once on the road and once here. Which means whoever it is, they have reach into a military medical transport system and a civilian hospital, and they're willing to escalate. That's not a small organization." "No," Archer said. "It isn't." "And you brought him here thinking it was safe." There was a beat of silence that carried its own kind of weight. "We brought him here because Hartwell has the designation and the transport logistics," Archer said, "and because we believe the leak originated from his operational team, not from the facility. We were wrong about that second part." She heard what he wasn't saying, which was that they'd put a man in a compromised environment and she'd been the only thing standing between that mistake and its consequence. She didn't say it back because it didn't help anything. "What happens now?" she asked. "Callahan stays here. We're securing the unit. My people will be on the floor through his recovery." He paused. "And we need to complete the conversation we started this morning about your position here." "My position is fine." Holt lifted the restriction. "Lauren." He said her name in a way that meant he was about to say something she wasn't going to be able to deflect with a factual statement. "The DoD wants to formally recognize what you did. Not just tonight, the full picture. The field service, Kandahar, and what's happened in the last 48 hours. That's a process, and it involves some decisions on your end that are worth understanding before anyone moves forward." She stood up. Not in agitation, she just needed to be on her feet. She moved to the window that looked into the corridor and stood with her arms crossed, not closed off exactly, more like holding herself in a shape that felt manageable. "I left the Army because I was done," she said. "Not because of the discharge. Because I was done. I came here to do the job I'm qualified for in a building that has walls and a heating system and isn't on fire. I know. I don't want a formal recognition process. I don't want to be a case study or a program or a story someone uses to make a point." "What do you want?" She didn't answer immediately because the answer wasn't simple. The honest version of it was complicated and partially formed and not something she'd articulated even to herself. What she wanted was to do the work without the weight of what she'd been following her into every room. What she wanted was to be taken at face value. What she wanted was, she stopped that line of thought because it was leading somewhere useful but not immediately actionable. "I want to finish my shift," she said. Archer looked at her for a long moment. Then he nodded. He stood and moved toward the door and stopped with one hand on the frame, the same position she'd been in when Holt had called after her 2 mornings ago. "Mercer," he said. She looked at him. "I've known Reed Callahan for 11 years, he said. "He has a daughter who's 7. She drew him a picture before he deployed. It's in his kit bag." He paused. "You gave him back to her. Twice. Whatever you want to call what's next, that part is done, and it's real." He left. Lauren turned back to the monitoring station. Callahan's vitals were steady, pressure holding, respiratory rate normal, the even lines of a body working the way it was designed to work when it was given the chance. She picked up his chart and began writing the 8 p.m. assessment. Her handwriting was the same as it always was, controlled, legible, each entry time-stamped. The fluorescence hummed. The corridor outside was quieter than it had been all day, which meant it was filling with a different kind of presence. She was midway through the clinical notation when her phone buzzed. Not Vaught's number. Not Archer's. A number she didn't recognize, which under any other circumstance she would have ignored. She looked at it anyway, because the message was only 3 words, and they rearranged everything she'd understood about the last 48 hours. Holt wasn't alone. She stared at the message. The sender had already gone. The number would be a burner. She knew that without checking, because whoever had sent it knew enough about how these things worked to know that was necessary. Her mind moved through the building. Every conversation she'd observed, every face she'd categorized, every movement that had registered as worth remembering. She'd been watching Holt. She'd been watching Jessica. She'd been watching the people she'd been told to watch. She hadn't been watching everyone. She put the phone down. She looked at Callahan's lines, the clean bag, the confirmed sterile flush, everything she'd verified. She looked at the door to the bay. She looked at the corridor through the window. There was someone in the corridor who didn't belong there. Not because of the way they were dressed. The scrubs were correct. The badge was Hartwell issue. The posture was institutional in the way that people who move through hospitals learn to be. But the movement was wrong. The direction was wrong. Nobody going to or from anywhere legitimate in this part of the unit moved that route at this time of night. Lauren stood up. Her chair made a sound against the floor. The person in the corridor heard it because they'd been listening, because they were the kind of person who listened, and they turned their head. She saw the face for exactly 2 seconds before they moved. It was someone she'd seen every day since she arrived, someone she had not once considered. She was already moving toward the door when the unit's main alarm went off. Not a patient alarm, the building alarm, the one that meant something had happened to the facility's security system, which meant someone had triggered it or someone had disabled it, and in this context, those 2 things had very different implications. She hit the bay door and came out into the corridor, and the person was already at the far end, near the stairwell, and Lauren was running. The stairwell door was still swinging when Lauren hit it. She went through without slowing, one hand catching the metal edge to redirect her momentum rather than fight it, and she was on the stairs before the door finished its arc. Below her, 2 flights, maybe 3, moving fast but not panicked, the footsteps of someone who had planned a route. She registered that detail without stopping. Planned. Which meant this person had been inside this building long enough to know its exits. She took the stairs at a controlled descent, not reckless, because a twisted ankle here ended everything. Her hand skimmed the rail at each landing. Her mind was running a parallel track. The face she'd seen for 2 seconds, the name assembling itself from the days of interactions she'd filed without consciously categorizing, the specific movements she now reread in a different light. Daryl's overnight pharmacy tech. His name was Garrett Pell. 40-something, quiet in the way that blended with institutional backgrounds, always present in the early hours when staff density was lowest. She'd noticed him without registering him, which was exactly the kind of presence you cultivated if you needed to move through a facility without creating attention. She'd made that same calculation herself when she arrived. She recognized the method because she'd used it. 3rd floor landing. She heard the door below bang open, ground level or basement. She couldn't tell yet. She went faster. Her phone was in her pocket. She pulled it without breaking stride and sent Vaught's number a single character, the floor designation for the stairwell exit at ground level, because she didn't have enough breath to manage a full sentence, and because Vaught was smart enough to read it. Ground floor door. She came through into the service corridor that ran behind the main lobby. Low ceiling, utility lighting, the smell of industrial cleaner, and the distant hum of the building's mechanical systems. She stopped, listened. The corridor ran in two directions, left toward the loading dock, right toward the electrical and facilities maintenance rooms. She heard nothing in either direction, which meant he'd stopped moving, which meant he knew she was behind him and he was making the same calculation she was. She went left. Not because the odds were better, they were roughly equal, but because the loading dock had exterior access, and exterior access meant variables she couldn't control, and everything she'd been trained in said you contained before you chased. The loading dock doors were closed. She checked the manual lock and it was engaged, which was either a good sign or a setup. She turned around. The door at the far end of the service corridor opened. Garrett Pell came through it with his hands up, not in surrender, but in the specific configuration of someone demonstrating they weren't holding anything, which was a different thing. His face was doing what faces did when a plan had arrived at a branch point it hadn't accounted for. Not fear exactly. Recalculation. "I'm not armed," he said. "I know," she said. She knew because she'd watched him move and the weight distribution was wrong for someone carrying, and because if he'd been armed, she'd have been dealing with a different problem entirely. "Where were you going?" "Out." "That door doesn't go out, it goes to mechanical." He looked at her steadily. He was breathing harder than she was, which told her the last several minutes had cost him more. "You're faster than I expected," he said. "Where's your exit?" A pause that was too long to be nothing. "There isn't one now." She heard the door behind her open. Vought came through it first, followed by one of the people she'd brought that Lauren didn't know by name. Vought took in the scene with a single rapid visual sweep and said nothing. She moved to Lauren's left. Her colleague moved right. Garrett Pell looked at the three of them. His hands were still up. Something in his face shifted. Not collapsing, more like settling, the way a structure settled when it stopped fighting the weight it had been holding. "I need to talk to someone with actual authority," he said. "Not the hospital, federal." "You're looking at her," Lauren said. He looked at Vought. "Are you DOJ?" "Adjacent," Vought said. "You'll want to start talking." He did. What came out in the next 8 minutes, standing in the service corridor under the utility lighting with the mechanical systems humming in the background, was partial and self-serving in the way that all confessions were when someone was managing their exposure rather than offering transparency. Lauren listened and filed every piece in order. Pell had been inside the facility for 14 months. He'd been placed there, his word, placed, which was specific and deliberate. His actual employer wasn't the hospital. His role was monitoring. He was one of 3 points, he said, though he'd only had direct contact with one of the others, which was how compartmentalized networks were designed and why they were hard to dismantle from a single thread. He hadn't introduced the contaminant to the IV bag. He was very clear about that. His job had been information, patient status, monitoring data, the kind of clinical detail that told someone on the outside whether a target was going to survive or whether a secondary intervention was necessary. The secondary intervention, he said, had not been his decision. "Whose was it?" Vought said. He looked at the ceiling for a moment with the expression of someone performing a rapid calculation of what the information was worth against what withholding it would cost. "I'll give you that in a formal interview with documentation," he said. "Not here." "You'll give us a name now," Vought said, "and you'll give us everything else in the interview. Or you give us nothing and we work backward from your phone records, your access logs, and whatever's on your locker, and you lose whatever cooperation credit you're currently accumulating." The pause was shorter this time. He gave a name. Lauren didn't know it. She filed it anyway. Vaught's colleague stepped forward and Garrett Pell went into custody without resistance, which was the one genuinely cooperative thing he'd done. Lauren leaned against the corridor wall and breathed. Her heart rate was coming down. It had spiked during the stairwell descent and her body was managing the return the way it was designed to, which was good, because she needed her mind clear for the next several hours, and adrenaline residue made thinking approximate. Vought turned to her. "You identified him." "I saw him in the corridor. His route was wrong." His badge showed nothing irregular. 14 months of access logs, no flags. He moved like someone who knew where the cameras were. Vought looked at her in the particular way that meant she was updating something. "How did you know the IV bag was compromised?" "The color in the drip chamber." "Our people reviewed that bag in the bay. They needed equipment to confirm what you caught by eye." Lauren said nothing because there was nothing useful to add to that. I need to ask you something, Vought said. And I need an honest answer, not a modest one. Okay. Is there anything about the way this has unfolded that you've noticed that we haven't acted on yet? Anything that doesn't fit the picture we're building? Lauren thought for a moment. She thought about the anonymous text. Holt wasn't alone, and she'd already given that to Vought, who had said it was likely Pell himself, covering for the possibility of capture by offering partial information through a secondary channel. That was plausible. She thought about Jessica Oren, who'd been passing monitoring data, and the shape of that, how long it had been running, whether Jessica had known what the data was being used for or had thought she was doing something less catastrophic. She thought about Drell, who had authorized her in the bay both times under pressure, and who had said exceptional to Holt's direct question. She thought about the name Pell had given. The name he gave you, Lauren said. It's going to have more than one connection point to this facility. Vought's expression didn't change, but her attention sharpened perceptibly. Why do you say that? Because the route that was leaked and the monitoring data that was passed and the contaminant in the bag, those are three separate operational requirements. Pell managed the monitoring. Someone managed the contaminant. The route came from a military system, not a hospital system, which means the connection to this facility was about the destination, not the origin. Whoever coordinated those three things needed a reason to know Callahan would end up specifically here. We've been working on that assumption, Vought said. But if the coordinator has a second point in this facility, someone other than Pell and Jessica, you haven't found them yet. Vought looked at her steadily. What makes you think we haven't? Because you're still here asking me questions instead of telling me it's resolved. A beat of silence. Then, there's a third access point we haven't closed. A credentialed user who pulled Callahan's room assignment from admissions at 11:47 p.m. on the night he arrived. The credential belongs to a staff member who was logged as off-site at the time. So someone used their credentials. Or the staff member wasn't actually off-site. Lauren straightened up from the wall. Who's the staff member? Vought looked at her for a moment that was a fraction longer than it needed to be. Dr. Marcus Drell, she said. The corridor was very quiet. Lauren had been in enough situations where a piece of information arrived that required a complete reassembly of what you thought you understood to be able to manage the cognitive shock of it without showing it on her face. She managed it now. She breathed once, deliberately, and let the new information find its position among everything else. Drell, who had excluded her. Drell, who had grudgingly authorized her interventions. Drell, who had said exceptional and looked like he meant it. Drell, who had told her you work with what you have, and nodded with what she'd read as the nod of a man seeing something for the first time. She'd read it wrong. Or she'd read it right, and he was two things at once, which was possible. People were not architecturally simple. She knew that. She'd learned it specifically and with difficulty. He saved Callahan's life, she said, both times. Once with your direction and once at your explicit instruction, Vought said, which could be read as a physician following a nurse's protocol rather than his own. You think he was trying to slow the treatment? I think we don't know yet. The credential pull might be explained. It might be stolen access. It might be a system error. It might be something else entirely. We're not concluding anything. But you're telling me. Because you're going back up to that unit, Vought said, and I need you to know the full picture. Lauren was already moving toward the stairwell. She came back onto the third floor at 9:14 p.m. to a unit that had absorbed the evening's events into its operational rhythm in the way that hospitals absorbed everything. The disruption became part of the texture. The staff moved around the new elements the way they moved around unfamiliar equipment, cautiously at first, and then by habit. There were two people she didn't recognize stationed near the trauma bay entrance. Daryl was at the nurse's station with the look of a man running on empty and professional obligation in roughly equal proportions. She checked on Callahan first. His pressure was holding at 94. His lines were clean. The new bag she'd hung, the verified flush, everything documented. She wrote a clinical note. She checked the monitoring leads. He was more consistently conscious than he'd been any point that day, which was progress. And when he tracked her movement, she stopped and said, "Still here." He blinked slowly. His mouth moved. She leaned in slightly because he wasn't strong enough for volume. "You were here before," he said. "First night." "Yes. I remember your voice." She didn't say anything to that because there wasn't much to say. She patted the back of his hand once. Not warmly, not like comfort, more like confirmation, and went back to the monitoring station. Drell came on for his evening rounds at 9:30. She watched him from across the unit. He moved with his standard authority, the gravitational surety she'd observed since her first hour in this building. He reviewed 2 charts at the station before coming to the trauma bay. He saw the 2 federal people at the entrance. He stopped. The stop lasted approximately 1.5 seconds before he continued moving, which was almost imperceptible and which told her something. He came into the bay. He looked at Callahan. He looked at the monitoring. He looked at Lauren. "How is he?" Drell said. "Stable. Pressure's holding. The security incident earlier." "Handled," she said. He nodded. He moved to review the chart and she watched his hands as he flipped through pages. Steady. Unhurried. The hands of a man who had been performing clinical competence for long enough that the performance was indistinguishable from the thing itself. "The credential pull," she said, and kept her voice at a volume that didn't carry past the 2 of them. His hands stopped moving. For exactly 1 second, they stopped. "What?" he said, and his voice was controlled, but the second of stopped hands had already happened. "Someone pulled Callahan's room assignment from admissions on the night he arrived, using your credentials, at a time when your access log shows you off-site." She watched his face. "Investigators are working through whether it was your credentials or whether you were actually here." He set the chart down. He looked at her with an expression that was doing something complicated, Chuck. Not the diagnostician's neutrality she'd read on him before, something with more moving parts. "I was off-site," he said. "I know." "Then there's nothing to—" "The question isn't whether it was you," she said. "The question is whether you know who had access to your credentials." The bay was quiet. Callahan's monitors ran their steady lines. Through the corridor window, she could see one of Vaught's people maintaining a peripheral position that was not quite visible from where Drell was standing. Drell looked at her for a long moment. Something moved through his expression that she had not seen there before. Not guilt exactly. Something older and more specific. "My access card was out of my possession for approximately 40 minutes last Thursday," he said. "I reported it to security as a misplacement. It was returned before end of shift." "You didn't think it was significant?" "It was a misplaced card. It happens." "Did you file an access review request with IT?" "No." She held his gaze. "You need to tell that to the investigators tonight, specifically with timestamps. If what you're saying is accurate, it's verifiable, and it closes the loop on your credential, but it needs to be documented before they reach their own conclusion." He was quiet. Then, "Are you telling me I'm a suspect in what happened to this patient?" "I'm telling you that the question exists and that the answer is yours to provide." Something in his face shifted in a way that she recognized from her own experience. The particular rearrangement that happened when a person who was used to being the most knowledgeable entity in a given situation understood that they were not, and that the gap was consequential. He'd been the authority in every room she'd seen him in. He was not the authority in this one, and she'd just made that clear without a single aggressive word. He picked up his phone and called the unit security line. She went back to writing her notes. The next 2 hours brought the kind of controlled chaos that investigations generated when they began consolidating. People moving between floors, documentation being gathered, the quiet accumulation of a case that was building not in the dramatic way that cases built in stories, but in the grinding, administrative way that real ones did. Vaught coordinated from the 4th floor. Archer had returned to the building at some point and was in a room Lauren hadn't entered. The 2 federal people at the trauma bay entrance rotated at 10 p.m., with 2 others who were slightly less visibly tense, which she took as a cautiously positive sign about the broader situation's trajectory. Drell's accounting of the missing access card was verified in part by the security log from the previous Thursday, which showed his card used at a terminal 47 minutes after his personal sign-out, in a building section that didn't correspond to any patient he was managing. The terminal was near the admissions interface. The timeline aligned. He wasn't cleared entirely. That wasn't how these things worked. But the immediate question of the credential pull resolved in his favor, provisionally. He came back to the unit at 10:45 p.m. and found Lauren at the monitoring station. He stood in the doorway for a moment before entering, and when he came in, he moved differently. Not less certain exactly, but with slightly less of the performance of certainty that she'd read as his default mode. "Thank you," he he said. Quiet, undramatic, the way people said things when they meant them rather than when they were constructing them. You would have gotten there, she said. Not as fast. He paused. They told me about the IV bag. What you caught. The color was off. 15% in the drip chamber. He repeated the number she'd given Vought, which meant Vought had told him, or he'd been in the room when she said it. She wasn't sure which. I've been a physician for 22 years. I don't know if I would have caught that. She said nothing. I owe you an honest statement, he said. Not about tonight, about the first night, and what I said to you, about military habits and protocol. You were operating within your framework. I was operating within my assumptions, he said, which is different, and I was wrong about you in a way that, given what's happened, could have been considerably more costly than it was. He looked at Callahan. I want to understand. The technique you used for the thoracic assessment. Where did you learn to do that without imaging? A surgeon who worked in austere conditions for 12 years, she said. He called it reading the patient's architecture. You learn the baseline feel of healthy tissue at specific locations, and you train your hands to recognize deviation. It takes a long time. Could it be taught in a civilian trauma context? She looked at him. The question was genuinely curious. She could read the difference between a question that was performing interest and one that had weight behind it. With the right framework, yes. Would you be willing to consult on a protocol development process? Ask me again in a week, she said, when this is finished. He nodded, and there was nothing more to say about it, so they didn't say anything more. At 11:30 p.m., Vought appeared in the unit. She moved to Lauren's position and stood with the precise economy of someone who had a lot to communicate and intended to communicate only what was necessary. The name Pell gave us opened 4 subsequent connections, she said. 2 federal, 1 military, 1 civilian contractor. The civilian contractor is the coordinator. His connection to this facility came through Holt, not directly, through a consulting arrangement that Holt engaged 2 years ago for infrastructure assessment. The contractor had facility access and used it to place Pell. Holt knew? Holt knew about the consulting arrangement. Whether he knew about Pell's actual role is currently undetermined. His lawyers arrived an hour ago, which is typical and not in itself informative. And the coordinator, the contractor, is in federal custody as of 40 minutes ago. Vaught's voice carried no particular satisfaction, just the flat fact of it. His name is Bernard Koss. He has a significant file, and this is not his first federal matter, which is why he had enough infrastructure to make this look like several separate unrelated problems. Lauren absorbed that. Callahan was a target specifically because of what he knows. Specifically because of an operation he ran 16 months ago that created certain people a certain kind of problem, Vought said. Yes. And they couldn't reach him operationally, so they waited until he needed medical care. Which is why the root leak happened at the military end. Someone inside that channel sold the information. We have that person as well. The picture was complete now, or close enough to complete that the remaining pieces were details rather than architecture. She stood with it for a moment, the whole shape of it, the way a series of apparently unrelated things had been one thing from the start, and she'd been inside it since the helicopter landed on the roof. What happens to Jessica Oren? She said. Vought considered the question. That's going to depend on the full extent of what she was passing and whether she was doing it with full knowledge of the use. She paused. What's your read? Lauren thought about Jessica. The early hostility, the performance of protecting protocol, the specific way she'd angled the notebook at the nurse's station. I think she knew she was passing information, she said. I don't think she knew to whom or what it would be used for, which doesn't resolve the action, but it might affect the outcome. Accurate reads like that generally come from somewhere, Vought said. I've watched a lot of people make bad decisions under pressure, Lauren said. They rarely look like villains from the inside. At 12:15 a.m., Daryl called for her near the station. Not urgently. Just a name called across the unit in the tone of someone who had something to tell her that wasn't an emergency. She walked over. There's someone in the family consultation room, he said. Been here about 20 minutes. Wouldn't say who she was. Security checked her ID and cleared her, but nobody knew what to do with her. He paused. She said she was here for the patient in Bay 2. She said someone called her. Lauren looked at him. Who called her? She didn't say. She had the room number. She had his name. He hesitated. She's got a little girl with her, maybe 7 years old, kids asleep on the couch. Lauren was quiet for a moment. He has a daughter who's 7. Archer's voice, from hours ago. She drew him a picture before he deployed. I'll talk to her, Lauren said. She walked to the family consultation room at the end of the unit hallway. Through the small glass panel, she could see a woman in her early 30s, dark hair, wearing the particular expression of someone who has been holding a specific fear for long enough that the fear has become the organizing principle of their face. On the couch beside her, a small girl in a puffy jacket was asleep with her head against her mother's arm. Lauren opened the door. The woman looked up. Her eyes were the eyes of someone who'd been doing calculations all the way here. Is he alive? Is he worse? Why did someone call me? What does it mean that someone called me? I'm Lauren Mercer, Lauren said. I'm one of the nurses taking care of your husband. The woman, she would tell Lauren her name was Dana Callahan, Dana, and Lauren would remember it. Looked at her with the question she was afraid to say out loud. He's stable, Lauren said. His pressure is holding. He's conscious. He's going to need recovery time, but he's stable. Dana Callahan put one hand over her mouth. The other hand stayed on her daughter's shoulder, keeping the girl anchored in sleep. Her eyes filled with tears that she didn't let fall entirely. They stayed at the edge, doing what they needed to do without becoming something she'd have to manage. Can I see him? She said. In a few minutes, Lauren said. Let me check with the team first. She went back to the bay. She checked Callahan's status. He was awake, more alert than he'd been all evening, his pressure sitting at 97. And she said quietly, Your wife is here. And your daughter. He closed his eyes. He kept them closed for a moment that was longer than a blink and shorter than what it contained. Yeah, he said. His voice was rough with days of intubation and sedation and the general damage of having survived something that should not have been survived. Yeah, okay. Lauren arranged the visit with the night supervisor, cleared the access with the federal team on the floor, who had their own protocols about the patient's security that required a brief conversation, and went back to the consultation room to get Dana Callahan and her sleeping daughter. She was walking them down the hall when her phone buzzed. She glanced at it. Vaught's number. Koss is talking. There's a 5th point of contact we didn't identify. Inside the hospital. Not Pell, not Oren, not the credential issue. Lauren stopped in the corridor. Dana Callahan stopped beside her with a questioning look. 5th contact is still in the building, Vaught's message continued. Current location unknown. Do not engage. Find a secure position and stay there. Lauren looked down the hallway. At the unit entrance, at the familiar shapes of a hospital at midnight. The nurse's station, the monitoring lights, the corridor that ran to the stairwell, and at the far end, just turning the corner, the back of someone she recognized. Someone who had been in this building every day she'd been here. Someone who moved with the unhurried confidence of institutional belonging. Someone whose role gave them access to every floor, every room, every system that Pell's limited placement hadn't covered. Her mind ran back through every interaction, every detail she'd filed as normal. The credential pull had been Thursday. Pell had been placed 14 months ago. Jessica had been passing monitoring data, but someone had needed to know to tell her what to monitor, and that instruction had to come from inside the unit's clinical structure, not from a pharmacy tech whose access was limited to a specific section. Someone who understood clinical monitoring well enough to know what data was worth passing. Someone who had been in the trauma bay during both of her interventions, close enough to watch what she was doing and report it. Someone who had been present when Callahan's room number was mentioned for the first time. Becca. The tech who had brought her coffee without being asked on the second day and said, For what it's worth, I heard what you did, who had been 24 and frank and uncalibrated in the way that made you lower your guard. Who had, Lauren now understood, been listening to every conversation from the position of someone nobody considered a threat, and who was currently moving toward the trauma bay. Lauren made a decision in the space of one breath. She turned to Dana Callahan and kept her voice even, enough that it didn't transfer whatever was moving through her chest into the woman standing next to her with a sleeping child pressed against her side. I need you to stay in the consultation room for a few more minutes, she said. There's a small delay with the access clearance. I'll come back for you personally. Dana looked at her. She was perceptive enough to read that something had shifted, but she was also a person who had been managing fear for days and had gotten very good at following the instructions of people who seemed to know what they were doing. Okay, she said. Lauren walked her back to the consultation room, closed the door, and then moved down the corridor at a pace that was fast without being a run, because running in a hospital at midnight changed the atmosphere of every room you passed. She texted Vought while she moved. Becca Talbot. Unit Tech. Moving toward Trauma Bay 2 now, South Corridor. She didn't wait for a response. She put the phone in her pocket. The South Corridor was empty when she turned into it. The Trauma Bay door was closed. She could see the monitoring lights through the small window panel. Callahan's line steady. Nothing alarming on the display. No one in the corridor between her and the bay. She slowed her pace and looked left toward the medication room and right toward the supply alcove, which was where Becca had been doing most of her work since Lauren's first night here. The supply alcove was dark. The medication room light was on. Lauren walked to the medication room door. She didn't open it immediately. She stood at the edge of the window panel and looked through at the angle that showed her the most of the interior without requiring her to stand directly in front of the glass. Becca was at the IV prep station. She was not preparing a standard solution. She had a secondary syringe in her right hand and a sealed bag on the counter, and she was moving with the focused efficiency of someone who had done this before and intended to be finished before anyone came to check. Lauren put her hand on the door. She had several options, and she ran through them in the compressed way that field experience had trained her to run through options. Not slow, not panicked, just rapid sequenced assessment of outcomes. She could wait for Vought. She could call out. She could go in now, and the question was whether Becca, confronted, would act in a way that required physical management, which Lauren was not opposed to, but which carried its own complications in a hospital setting at midnight. She chose the door. She opened it and walked in and said, in the same tone she used for clinical instructions, "Set that down." Becca turned around. She was 24 and she looked it. She looked exactly what she was, which was a young woman whose face had not yet learned to fully suppress what was moving underneath it. What was moving underneath it right now was a complex mixture that Lauren read in roughly a second. Fear that was genuine, calculation that was trained, and underneath both of those something that was harder to name. Not remorse exactly. The expression of someone who had decided a long time ago that what they were doing was justified and was now arriving at the moment where that decision was required to hold its weight. It wasn't holding. "Lauren?" she started. "Set it down," Lauren said again, the same tone. No escalation, because escalation was for people who didn't know how to make stillness do the work. Becca set the syringe on the counter. Her hand moved away from it in the way that hands moved away from things when the body was making a decision the mind hadn't finished making yet. "It was empty," Becca said. "I hadn't loaded it yet. I know what I saw." "It doesn't matter. Whatever you think it wasn't Becca." She said the name the way you said a name when you needed someone to stop. Just the name, with enough weight that the space after it became something a person had to fill with truth rather than deflection, because the deflection had nowhere left to go. Becca looked at the floor. She was breathing fast. Her hands, now at her sides, were doing the thing hands did when a person was trying to remember what to do with them. "Who gave you the instructions?" Lauren asked. A long silence. "It doesn't matter now." "It matters for what happens next," Lauren said. "What you did, what you were about to do. Those are separate questions with separate answers, and both of them matter. But who gave you the instructions determines whether you're the top of this or the bottom, and that difference is not small." Something in Becca's face shifted. Not breaking. The breaking had already happened, somewhere before this room, in the accumulation of decisions that had led here. This was something after breaking. "Koss," she said. "Bernard Koss. He recruited me 2 years ago, before I even came to Hartwell." She swallowed. "I didn't know it was going to be like this. He said it was intelligence work, passing information. He said the targets were people who were... He said they were threats." "Callahan," Lauren said. "What did he tell you about Callahan?" "That he'd done something that cost lives. That the operation he ran had..." She stopped. "I don't know if that's true. I don't know anymore if any of it was true." Her voice had gone thin. "The bag last night, with the contaminant. That wasn't me. I didn't do that." "Pell," she blinked. "I don't know that name." "You were passing monitoring data," Lauren said. "Someone else managed the physical intervention. You didn't know about each other." "No." A pause. "That's how he ran it. Compartmentalized. You only knew your piece, which was clinical status. Yes. The door opened behind Lauren. She didn't turn around because she'd heard the footsteps in the corridor and had already identified them. Two people, one slightly heavier than the other, both moving with the controlled pace of people who had done this enough times that urgency was no longer visible in their movement. Vought came in first, followed by her colleague. Becca saw them, and the last of whatever she'd been holding together dissolved, not dramatically. She didn't cry. She didn't speak. She just got smaller. That was the only way to describe it. She got smaller and younger and more genuinely her age, and she let Vaught's colleague move her to the side and begin the procedural part of what came next. Vaught looked at Lauren. She looked at the syringe on the counter. Empty, she said. She hadn't loaded it. The bag from last night is still in evidence. That'll close the gap. She said something to her colleague about the syringe being preserved and then turned back to Lauren. Koss named her in his statement 20 minutes ago. We were already moving. She didn't know about Pell. No, he kept the physical intervention separate. Vaught's voice carried the neutral weight of someone building a case piece by piece. She's young. Her cooperation profile is going to matter significantly for how this resolves. I know, Lauren said. She looked at Becca, this woman who had brought her coffee and made her feel briefly, incrementally less like a foreign object in the institution she'd arrived in, and who had been building a second record under that ordinary surface. She believed what she was told, Lauren said, about Callahan. A lot of people believe what they're told, Vaught said. That's the mechanism. I know, Lauren said again. It doesn't excuse the action, but it's the human part of it. She left the medication room and stood in the corridor and let herself be still for 30 seconds. The hospital hummed around her, its systems, its lights, its constant low-grade negotiation between order and chaos. She'd been inside this building for just over 60 hours. It felt like a different calculation entirely. She went back to the consultation room. Dana Callahan looked up when the door opened, and her expression was the concentrated version of every question she hadn't asked since arriving. Her daughter was still asleep against her arm, the puffy jacket rising and falling with the unremarkable confidence of a child who had learned to sleep in uncomfortable places because her parents' life had required it. You can see him now, Lauren said. Dana stood up carefully so as not to wake the girl, and then seemed to decide something and woke her gently anyway. A hand on the shoulder, a quiet word. The girl surfaced from sleep with the disorientation of children who take a moment to locate themselves. And then she looked at her mother, and her mother said, "We're going to see Daddy." And the girl made a sound that Lauren didn't try to process, because she was already looking at the hallway to give them a moment that wasn't hers to witness. She walked them to the bay. She cleared the access with the federal agent at the entrance, who stepped aside without discussion because the clearances had been arranged, and opened the door, and then she stayed in the corridor. Through the window, she watched Dana Callahan go to her husband's bedside and take his hand and saw his eyes open and his face do something that faces did only in very specific circumstances. When the person looking at you was the exact person that had been sustaining you through everything, and their presence made all of it suddenly, physically real in a way that had been abstract until that moment. He didn't say anything. Neither did she, immediately. The little girl climbed carefully onto the edge of the bed, too careful, the way children were careful when they'd been told to be careful about something important, and pressed her face against her father's shoulder. Lauren moved away from the window. She walked to the end of the corridor and stood at the window that looked out over the eastern edge of Caldwell, and the city was doing what cities did at this hour. Its light spread across the dark in the uneven, imperfect pattern of a place that had been built by thousands of separate decisions rather than any single plan, and it looked like what it was, which was real. Archer found her there at 1:15 a.m. He came to stand beside her without announcing his presence, which she appreciated. "It's over," he said. "Koss. In custody. Cooperative in the way people are cooperative when they understand the full scope of what they're facing." He paused. 3 other operations are being reviewed. This isn't the only time he used medical access as a mechanism. It's the first time it failed this early. Because Callahan ended up here. Because Callahan ended up here, he said, and you were on shift. She said nothing to that. The DoD recognition process, he said. I want to come back to it. I haven't changed my answer. I know, but hear the specific version. He turned slightly toward her. There's a program currently in early development, Joint Civilian Military Trauma Training. The premise is that combat medicine and civilian emergency medicine have developed in parallel for decades, and there's a significant gap in cross-pollination. Techniques that work in austere environments that aren't available in civilian trauma rooms. Civilian protocols that could save lives in field conditions that military medics aren't trained in. He paused. The program needs someone who lives in both worlds and can translate between them. Someone who knows what it costs to hold knowledge that institutions haven't figured out how to recognize yet. She looked at the city. That's a long description for a job offer. It is a job offer. Attached to this hospital? Structured as a partnership. You'd hold your position at Hartwell, assuming the hospital is interested, and I believe after tonight that question has a clear answer. And consult with the program on curriculum and protocol development. It's not a return to active service. You don't deploy, you teach. He let that sit. The people you teach deploy. She felt the weight of that, the specific weight of it, which was different from what she'd expected to feel. She'd thought the idea of formalizing this role would feel like being put back in a box, a different shaped box, but a box nonetheless. It didn't feel like that. It felt like something she hadn't let herself think about directly, because thinking about it directly would have required believing it was possible. I'd need complete autonomy on curriculum, she said, within the program's scope. I'd need it in writing. Understood. And I'm not a poster, she said. I'm not a story someone uses to recruit or to make a press point. The work is the work. That's the job description, he said. The work is the work. She was quiet for a moment. Outside, the city held its shape against the dark. Ask me again in a week, she said. The same answer I gave Drell. When this is finished, and I've slept, and I can think about it without adrenaline in my system. Fair, he said. He left. She stayed at the window for another few minutes, then went back to finish her shift. The administrative proceedings that followed over the next several days were not swift, because they were never swift, because institutions moved at the speed of documentation and legal review and the specific caution of organizations managing their exposure to a situation that had exceeded their standard categories. What they were was thorough. Bernard Koss was formally charged through federal channels, conspiracy, obstruction, and 3 counts related to interference with a protected federal witness, which was the category Callahan's status fell into given the nature of the operation he'd run. The charges were detailed in a press statement that the U.S. Attorney's Office released on a Tuesday afternoon, and the statement was specific enough that anyone reading it carefully could follow the chain from the root leak to the hospital placement to the contaminated IV bag to the arrest in a Hartwell Regional Service corridor. Koss's name was on the front page of 3 national publications by Wednesday morning and attached to a photograph that showed a man who looked entirely ordinary and had made extraordinary choices in the direction of harm. Garrett Pell cooperated fully in exchange for a reduced charge structure. His cooperation produced 2 additional arrests connected to Koss's network in a separate region, which was its own closed chapter. Jessica Oren was suspended pending investigation. The investigation concluded that she had passed monitoring data, believing it was part of an authorized intelligence operation, a belief that Koss's network had deliberately cultivated through a recruitment process that had taken over a year to complete. She had not known Callahan was the subject, or that the data she passed would be used to determine whether a secondary physical intervention was necessary. The distinction didn't eliminate her culpability, but it shaped its legal form. She resigned before the suspension could be converted to termination. Lauren heard about it from Daryl and said nothing, because there was nothing to say that wouldn't be either too much or too little. Becca Talbot's situation was more complicated because her cooperation was extensive, and her prior knowledge of the end use of her information was genuinely ambiguous in the way that the most legally interesting situations were genuinely ambiguous. She was 24, and she had been recruited at 22 by a man who understood how to find people at the specific moment when their need for purpose was greater than their ability to evaluate the cost of what they were being offered. Lauren wrote a factual statement for the review process when she was asked. She stated what she'd observed in the medication room. She stated Becca's own words about her belief regarding the operation's nature. She did not advocate for a particular outcome. She gave the facts and let the people whose job it was to weigh them do that job. Richard Holt was not charged. The investigation concluded that his credentials had been used without his knowledge and that his administrative actions, the call taken behind the closed door, the alternative communication channel, were consistent with a consulting relationship he'd disclosed in his employment record with Koss's contracting firm, which had operated under a legitimate corporate structure for the specific purpose of providing institutional access without triggering compliance flags. Holt had been used rather than complicit. He returned to his position after a 2-week administrative leave. The first morning back, he came to find Lauren in the trauma unit and said, "I owe you an honest accounting of how I handled your first 48 hours here." "You were working with what you had," she said. "I was working with my assumptions," he said, and the words were Drell's words, and it took her a moment to realize he'd spoken to Drell, that Drell had told him what she'd said. "I made decisions about your value to this institution based on categories that had nothing to do with your actual capabilities." He paused. "I'd like to understand how we build a process that doesn't do that. To the next person who comes in with a background that doesn't fit our documentation framework." She looked at him. "I'll send you a proposal," she said. He nodded. He left. Drell was different after everything, in the way that people were different when something had reached in and moved the furniture without their permission, and they'd had to decide whether to move it back or find a new arrangement. He was still certain. He was still the gravitational center of his trauma team. He was just certain with a slightly wider aperture, a quality of attention that now included the margins as well as the center. She watched it in him and recognized it from her own experience, the shape that competence took when it had been expanded by something it hadn't anticipated. He formally requested her involvement in developing a civilian trauma protocol that incorporated advanced field assessment techniques. She formally agreed. They spent 3 weeks arguing about every element of the framework with the productive antagonism of two people who were both right about different things and knew it. And what came out of those arguments was better than what either of them would have produced alone, which was the only justification for how difficult the process was. Callahan was discharged from Hartwell Regional 17 days after the helicopter landed on the roof. His recovery was not smooth. There were setbacks, readjustments, days when the progress that had seemed solid turned out to be provisional. That was how serious injury worked. Lauren was not his primary nurse after the first week, when his condition stabilized enough for a structured care team to take over, and she was not present for his discharge. She was in a trauma bay with a new patient when it happened. She found out from Daryl, who said, "Your helicopter guy went home this morning," with the matter-of-fact delivery of someone reporting a fact rather than a conclusion. "Good," she said. She meant it without ceremony. Good was the entire point. Good was the thing the whole 60 hours had been about. That a man with a daughter who drew pictures and a wife who could sleep in a consultation room chair went home. Everything else was the structure built around that fact, and the structure mattered, but it wasn't the fact. 3 weeks after Callahan's discharge, Lauren stood in a room on the 4th floor of Hartwell Regional in front of 14 people, physicians, nurses, residents. A representative from the DoD program Archer had described at the corridor window, and taught the first session of what would eventually become the Cross-Environment Trauma Competency Program. She'd written the curriculum over 2 weeks of evenings, arguing with herself about every section with roughly the same productive antagonism she'd brought to the sessions with Drell. The room was a standard conference room with institutional chairs and a whiteboard and coffee that had been sitting too long on the burner, which she noted and did not fix because some things were outside the scope of what she was there to change. She started without preamble. The first thing you need to understand about austere trauma medicine is that it will not ask your permission before it requires something from you that you don't know yet. You will be in a situation where the imaging isn't available, the blood bank is an hour away, the patient's pressure is dropping, and the technique you need is one that isn't in any protocol you've been trained in. That situation is not exceptional. For certain categories of patient, it is the rule. She paused and looked at the room, at the physicians who had arrived with the careful professional skepticism of people who had been good at their jobs for long enough to have opinions about what additional information they needed, and at the nurses who had arrived with more of themselves on the surface, more visibly open to the possibility that there was something here worth knowing. "I'm not here to tell you that everything you know is wrong. Everything you know is necessary. I'm here to show you what comes after it." She was not, she had decided, a person who made speeches. She was a person who demonstrated and explained and answered questions and lived with the discomfort of knowing that what she taught would go into the world and be used in situations she'd never see, by people she'd never meet, for patients whose names she'd never know. That was the specific kind of faith, not in anything supernatural, but in the compounding nature of competence that her years of training had built in her. You put the knowledge in the right hands and you accepted that you couldn't track every consequence. You trusted the transmission. She was good at this. She'd known she would be, in the abstract, but knowing it in the room was different. The way any knowledge was different when it became experience rather than prediction. She watched a resident absorb the thoracic assessment technique with the concentrated attention of someone encountering something that reorganized their understanding of what was possible, and she recognized that moment from her own history, the specific quality of a framework expanding. That was the work. Unglamorous and essential and replicable, which was the only quality that mattered at scale. She was 41 years old, and she had spent 19 years carrying a version of herself that institutions couldn't process, and individuals didn't know how to hold, and she had arrived at a hospital in Caldwell, Colorado, on a night shift wearing borrowed scrubs and a badge with a laminate peel on the back, and what had met her was not a welcome. What had met her was a system designed to sort her into a category it understood, staffed by people who were doing their jobs and protecting their territory, and operating from the same human instinct to trust the familiar over the unfamiliar that every institution ran on. She didn't blame any of it. The understanding didn't make what had happened acceptable, but it made it legible, and legible was the beginning of changing rather than just enduring. What she wanted, the answer to Archer's question that she'd given incompletely in the corridor window, was this. Not the formal recognition, not the military record review that had been completed and sealed with a set of notations she'd read once and filed. Not the apologies, which had been real in the way that apologies were real when the people offering them had genuinely reconsidered something. Not even the program exactly, though the program was where the want became useful. What she wanted was what she was doing in this room. The transfer of something real. The specific refusal to let hard-won knowledge die in the person who earned it. The insistence that what you'd learned in the worst moments of your life had value beyond the worst moments of your life. She'd come here to start over, and she had, but not in the direction she'd expected. She hadn't escaped what she'd been. She'd found the version of it that belonged in the next chapter. The session ran 90 minutes. At the end, a physician she didn't know well, a woman named Dr. Priyanandal, one of the senior trauma attendings who'd been brought in specifically for the program, asked a question about improvised pressure assessment in pediatric cases, and Lauren spent 10 minutes on the specific adaptations and watched the room follow the reasoning with the concentrated engagement of people who understood they were being given something that mattered. When the session ended and the room was clearing, Drell stayed behind. He gathered his notes with the deliberate pace of someone who had something to say and was deciding whether to say it now or carry it home and think about it more. He said it now. "You should know," he said, "that 3 of those residents are going to go home tonight and not be able to stop thinking about what you showed them today. That's the point." "I know." He looked at his notes, then at her. "I was wrong about you on day 1. I've said that. I'm saying it again because I think it's worth saying more than once, and because I'm aware that the correction doesn't undo the cost of the original position." She looked at him steadily. "The correction is what you do now," she said. "That's where it lives." He nodded once, the different kind of nod, the one she'd first seen in the trauma bay and learned to read as genuine. He left. She stayed in the room alone for a few minutes after everyone had gone, standing at the whiteboard with its diagrams and notations and the specific productive messiness of a session that had been real rather than polished. She looked at what was on the board and thought about the next session and the one after that, and the slow accumulation of people who would carry some version of this forward into situations she'd never witness. Her phone buzzed. A text from a number she now recognized, Dana Callahan. "Reed wanted me to tell you. He started physical therapy this week. Hard day, but he went. He wanted you to know." She read it twice. "Shh," she typed back. "That's the whole job. Tell him to keep going." She put the phone in her pocket and picked up the whiteboard eraser and began clearing the board for the next session. Outside, Caldwell was doing what it did in the late afternoon of an early autumn. The light came in low and specific off the mountains to the west. the kind of light that made ordinary things look briefly precise, briefly worth examining. It came through the conference room window and lay across the institutional carpet and the institutional chairs and the whiteboard that she was clearing. She didn't stop to look at it because she had work to do. But she noticed it. She had learned, over years of being in places where beauty was intermittent and catching it required paying attention to the margins of things, to notice, even briefly, even while moving, to register that the light was doing something particular and that she was in it, and that both of those facts were worth something, not in a way that needed to be named or held on to, but in the way that living things registered the presence of something good without requiring it to justify itself. She finished clearing the board. She wrote the heading for the next session in clean, even letters across the top. Field assessment without imaging, principles and application, and stood back and looked at it. Then she went back to work. Not as a soldier, not as a nurse who had survived being overlooked by people who should have known better, but as someone who had paid the full price of the knowledge she carried and had decided finally that the price was worth it. Not because the cost had been fair, but because the alternative was letting it count for nothing. She had been underestimated by people who built their understanding of others on the width of a badge and the fit of borrowed scrubs. She had been excluded by a system that ran on legible credentials and distrusted what it couldn't document. She had been placed on restricted duty for saving a man's life, in a building where saving lives was the stated purpose, because the method she'd used came from somewhere the institution hadn't thought to look. None of that had broken her. It had clarified her. And what she'd found in the clarification was something more durable than recognition, more useful than vindication. The knowledge that what she carried was real, that real didn't require permission, and that the only genuine response to having been underestimated was to go on being exactly what you were until the room caught up. The room had caught up. She turned to the next page of her notes and got on with it.